VA medical center workers around the country have been saying that they're being ordered to ration and recycle PPE like masks, which is putting them at greater risk for getting coronavirus on the job. You can see the sign this one woman is holding. It says, "Say no to 1 mask per week." Sounds dire, right? 1 mask per week? Practically no medical system in the U.S. has what it needs in terms of protective equipment. But for weeks, we've been hearing about particularly dire shortages in the country's VA's facilities. And that's particularly worrying because VA facilities are responsible for the care of more than 9 million American veterans, a majority of whom are older and therefore at increased risk when it comes to coronavirus. For most of the time that we've been seeing these reports, the VA's leadership has been insisting that all is well, and people are complaining for no reason because the VA and all its workers have everything they need. When the Wall Street Journal, for example, reported on internal documents showing that facilities really had begun rationing PPE, a VA spokesperson said in response, quote, "The premise of your question is false. All employees who need PPE have it." That may be the line from the VA, but I can also prove to you that that is absolutely not the situation on the ground. We recently obtained an email that was sent to employees at the VA Medical Center in Charleston, South Carolina. And it has to do specifically with the face mask policy in effect at that facility. According to the memo, VA workers are separated into 2 groups. The first is Priority Group 1, those at high risk of exposure. Here's the face mask guidance for those Priority 1 employees. Quote, employees caring for COVID-19 positive patients not undergoing high-risk procedures will receive 5 face masks as a 2-week supply. The patient should be encouraged to put on a face mask when someone enters their room. The employee's face mask is reusable between patients. Those employees, those Priority 1 employees, are encouraged to store their own masks in their paper bags when they're not using them. But again, those are the lucky employees because VA says they're at high risk, so they each get a grand total of 5 face masks that need to last them for 2 weeks. As for Priority Group 2, VA workers who work in outpatient care or as screeners at these facilities or folks who work at community-based outpatient clinics. Well, here's the guidance for them. They'll be issued 1 mask per week in a paper bag. At the end of the week, store the mask in the paper bag. At the beginning of the 2nd week, staff will be given a 2nd mask. Those 2 masks will be a 4-week supply. 1 mask to be worn each week and each mask reused for a 2nd week. Like their colleagues in the Priority 1 high-risk pool, the Priority 2 employees are encouraged to keep their masks in paper bags when they're not using them. So the highest risk medical providers is decided by the VA. They get 5 masks to last them 2 weeks. The second priority group of VA employees, including people working as screeners at these facilities, they get 2 masks that are supposed to last them a month. Use 1 for a week, then use the 2nd one for the next week, then go back to the 1st one for your 3rd week, then use them. We asked that VA medical facility for comment to see if this policy is still in place. They forwarded us on to the National Press Office for the Department of Veterans Affairs, where that national spokesperson told us in part, quote, VA is currently adhering to CDC's contingency capacity posture for PPE use. VA's PPE practices are keeping veterans and employees safe during challenging times, and the numbers prove it. That spokesperson also says, quote, there is no VA-wide guidance categorizing staff by priority groups. Well, I guess that means we know there's not standard guidance across the board for VA workers when it comes to using face masks. It just depends which part of the enormous VA you work for. I mean, the sheer scale of the VA makes this an enormous problem. The failure to get needed equipment in the hands of every VA caregiver right now. I mean, we're hearing that from VA workers who are picketing and protesting outside their workplaces so people know this is what's going on. But the strategy from the VA, which again is a federal agency, it's part of our government, the strategy from them over and over again has been to just happy talk this problem. And that might have worked for a while were it not for the protests of healthcare workers themselves, and were it not for one intrepid reporter in particular who has consistently exposed the extent of this problem despite the VA saying there's nothing to worry about. And that intrepid reporter joins us next. Stay with us. This was the first big scoop almost 2 weeks ago. The headline, Veterans Affairs hospitals facing serious shortage of protective gear, internal memos show. Even while publicly the VA was saying everything was fine. One VA healthcare professional told Wall Street Journal reporter Ben Kesling, quote, the fear is palpable, when Kesling kept reporting on this as a line of inquiry at the Journal. Then just a few days ago, Ben Kesling got the VA secretary himself to finally acknowledge the problem. Quote, in a better situation, would we have more supplies available? Yes, but we are competing with the rest of the country. Joining us now is Wall Street Journal reporter Ben Kesling, who's really been driving the heck out of this very important story. Mr. Kesling, thank you for joining us tonight. Thanks for your reporting on this issue so far.
Thanks for having me.
The thing that I find remarkable about this story and what you've reported is not that VA has had a hard time putting together enough PPE to protect all of their medical staff. That does not surprise me, sadly. I'm disappointed and worried about it, but not surprised. What I'm surprised about is that there's this huge disconnect between that fact on the ground and all of this happy talk that VA has been spreading about it, trying to say it's fine and there's no problem. That's at least the impression that I've had, but I wanted to ask whether that lines up with your impression as you've pursued this line of inquiry.
It lines exactly up with what I've been reporting. And in talking to doctors and nurses, providers on the ground, they understand that there's shortages. We all know there's shortages. Where the nation is facing a shortage in PPE, from masks to gowns to face shields to everything. And since the VA is part of the national medical system, they're of course going to be facing shortages. Doctors and nurses just want that to be honestly conveyed to them. And until recently, the VA was not saying that there were any shortages. In fact, every time I would reach out to ask for comment, I would be told that the premise of my questions is wrong, and that there was plenty of gear. There were no shortages.
I know that a lot of your reporting has been based on internal memos that are being circulated among top-level VA employees. So they've got this public-facing line that everything's fine, but at the highest level of the agency, they're circulating memos very concerned about rationing and the extreme things they're needing to do in order to try to spread minimal PPE around this huge workforce. And obviously, I'm not asking you to compromise or even characterize your sources, but is it fair for those of us reading your reporting to draw the conclusion that there are a lot of people at the VA, including high-level people at the VA, who see value in having this information out there, despite the fact that it contradicts the official line from the agency?
Yes, in a word, yes. And the folks who are providing a view into these memos, they want to make sure that this contradiction is pointed out, that it's shown that the VA just needs to step forward and say, hey, we don't have all the supplies we need. We understand that. We're going to have to use crisis level de facto rationing of equipment, and we're working to get more equipment, but we don't have it. And doctors and nurses, the folks who are part of this system seeing these memos, just want that to be honestly conveyed. And until recently, it hasn't been conveyed. And it's only in the past couple days that the VA leadership has really stepped out and started doing more broader media appearances and talking about the fact that there is not, as the secretary puts it, optimal levels of PPE, and that the department's going through 130,000 some masks a day. You're gonna run up hard against shortages when you do that, and that they're now coming out and saying maybe the messaging could have been better. We could have talked about this more. We could have just told people that we were in the same boat as the rest of the nation.
Ben Kesling, reporter for the Wall Street Journal. I will tell you, your reporting is what has finally forced them to be more honest about it, and we all owe you a debt for that. Thank you for staying on this. Thanks for your time tonight. Good luck.
Thanks.
All right, we'll be right back.